Hello, everybody. Welcome to another episode of Prescribing Lifestyle Podcast. Today, I have a very special guest for you. It's Dr. Olivia Ong. We actually spent a day together yesterday. She came to support me in my speaking engagement at 10X yesterday. She is an amazing human. She's a doctor like I am. She's a pain specialist, also an amazing speaker and author. She's got a journey because of a spinal cord injury. So welcome to the Prescribing Lifestyle podcast, Olivia.
Yep, thanks for having me, Avi.
It's so lovely to connect with you, and you are so supportive of my journey. So I'll get you to tell us, how did you get into this space? So you talk about burnout, you had an injury. What happened?
Well, burnout actually started probably, if I look back now, Steve Jobs talked about joining the dots backwards to get a full picture of what actually is going on. So that's actually what I've done so far with my burnout journey. When I started residency after I graduated from medical school, I think that was when I started experiencing quite severe burnout as an intern. Because when I look back, I remember that I was getting sick a lot, getting coughs and colds quite easily. And I mean, as an intern, it's a pretty stressful year because you're
Yes,
trying to find your feet and then you're trying to, look after 30, 40 patients. I mean, in my time, we had to look after 30, 40 patients.
I
Obviously
did that
now,
too.
obviously now it's a totally different um, workload, but in our time, it's about that. And I think the burnout started way back then, and then kind of spilled over to residency, and then registrar. I started my first year as a rehab registrar, probably in I'm just thinking of about late 2007, and I started my second year actually in training probably about August 2008. That's the reason why I mentioned 2008 because that's obviously a very significant year for me. So 6 weeks after I started my second year as a rehab registrar, I had unfortunately a life-changing event happened. I was, walking to attend a normal tutorial. I mean, as rehab registrars, we are required to attend a Wednesday afternoon tutorial at different hospitals every week. It's just part of our training program. And as I was walking towards the hospital where I was about to attend the tutorial, which is, it was at the Royal Talbot Rehab Hospital, which is the rehab hospital of the Austin. As I was walking towards the main entrance, I just remember seeing a old worn out Toyota at the corner of my eye. But like when you just don't make anything out of it, you see cars when you walk in car parks and go, okay, let's just get on with my life type of thing. But unfortunately, it didn't happen that way. As I was walking, unfortunately, this car instead of accelerating forward, he probably put in the wrong gear and reversed backwards, and then hit me at very high speed. So that all happened very quickly, and I was with another registrar who was also involved in the accident
No
as
way.
well, but her injuries were less severe than mine.
Mm-hmm.
I just remember instant sharp pain in my lower back, and I remember just being flung into the sky very quickly. It all happened very quickly, and I landed on the ground with a sharp thud. And then when I kind of looked around, I think a few seconds later, when I looked around, I was, lying in a really painful, awkward fetal position, and I just
Mm-hmm.
realized that I probably broke my back at that point
Mm.
in time. And being a typical doctor, you start triaging yourself and I'm going, oh, I mean, the sky, I can comprehend that because I was lying on my side, so I could see the sky.
Yeah.
And I'm like, okay, if I can comprehend that the sky is up there and I'm lying on my side, means I didn't have a traumatic head injury because we have this thing called post-traumatic amnesia. You will forget everything. I'm like,
Mm.
I'm pretty sure I'm aware about what's going on with me. I'm aware that doctors are coming towards me and panicking, seeing that I was injured.
Mm.
And I went, okay, I didn't have a traumatic head injury. And then I started moving my arms and I went, well, I'm not a quadriplegic because clearly I'm still able to move my arms because I hear all these stories about, rugby players being quadriplegics when they will tackle and they can't move their arms and all this. And I'm like, okay, I'm not quadriplegic. That's as I was going triaging to the lower part of my body, I went, oh, I don't think I can actually feel the lower part of my body. In fact, I felt as if I was chopped up in half. which is quite gruesome, really, but that's how I felt. And I realized, okay, I don't feel my legs. I can't even move them. Okay, this is a spinal cord injury. And I remember learning about spinal shock just about probably about a few months ago for my entrance exam for rehab. And I went, okay, this is spinal shock. Okay, don't panic, don't panic. But this is, the more you tell yourself you don't
Mm.
panic, you actually panic more. It's a bit like that.
Mm.
And then it doesn't help when there was a code blue called, and I was it. I was the code blue. So
Oh my
everyone rushed
God.
towards me. Nurses, doctors from who are working in Talbot rushed towards me. So there were other registrars who were also making their way towards the tutorial place. So they came and helped me out, and as well as the Talbot medical and nursing staff. But I guess the fortunate thing about having an injury like this in a hospital setting, you get immediate medical attention.
Mm.
Ambulance came within less than 10 minutes. And I just remember being in the ambulance with my fellow rehab registrar who was injured. I think for her, she injured her knee and had lots of
Mm.
facial lacerations. So she was
Mm.
able to get in to the ambulance with me. But for me, they had to make sure that I had all the spinal precautions, wheeled me into the ambulance. And I just remember very clearly they asked me a question: do you want to go to the Alfred Hospital or St. Vincent's Hospital? And I just remember a few months ago, I was in an ambulance with one of my patients who had a tracheostomy and it blocked up. So I was there in the ambulance. I went, okay, Alfred is the, you know, trauma lead, one of the
Yeah.
leading trauma hospitals.
Hmm.
I would like to go to the Alfred, thanks. Because interestingly, the Austin was on bypass, even though
Oh.
my accident happened at an Austin facility. And I went, okay, this day is not getting, is not moving ahead as smoothly as I thought. So that's all happened. It happened very quickly. I had emergency spinal surgery that same night
Wow.
at the
Same
Alfred.
night.
Yeah, yeah, very quick because they did a CT and they saw how bad I was injured. I had a L1, L2 dislocation,
Oh
and
wow.
L2 vertebra has burst. And I mean, at that time, they didn't even have time to do MRI, but clearly, I think the bone fragments have caused a lot of huge bruising on my quarter equina.
So it was fractured as well as
Yeah,
moved
it's
up, moved around.
yeah, it was high impact trauma. So I imagine my back was smashed literally.
Oh my God.
And that's why they said we have to we have to fuse your back. There's no other way, or else you will get worse and worse. I mean, it's already worse. I couldn't feel or move my legs, and
Yeah,
I
yeah.
think that's probably as worse as it gets. And I think if I didn't have that spinal surgery, I will probably be a complete paraplegic.
Yes.
And thankfully, that spinal surgery, that stabilization and fusion, um, helped me become an incomplete paraplegic, which means that they were able to, like, I regained sensation, full sensation immediately after the spinal surgery, and I was very grateful. So I could
Yeah.
feel everything. I could feel my, organs. I could feel my legs. I just can't move them.
Yeah.
I mean, at that
Okay.
time, you're a bit drowsy from all the, PCA or the IV morphine.
The
So you're a bit
painkillers.
like,
Yes.
yeah, I just, yeah, I remember I used a lot of that because it was so painful.
Wow. How long were
Um,
you in hospital for?
yeah, I was at the Alfred for about 2 weeks, and I
Okay.
went once they've got a bed and three and off, which is, like the Austin is the leading spinal unit, like spinal cord injury unit for
Okay.
any acute injuries as well. That's why I was meant to go to the Austin, but obviously that didn't work out, and I ended up at the Alpha, and that's fine. Like I had a really good surgeon who operated on me,
Yeah. Yeah.
who I had the opportunity to thank 5 years later because she was doing a tutorial for us rehab registrar. So I had
Oh
the opportunity,
wow.
beautiful opportunity to thank her for saving my life, basically, and it was a beautiful moment. Um,
So how long were you in
anyhow,
rehab for?
rehab rehab was the longest. Avi was 4 months.
Wow.
Um, 'Cause I think 4 months is not too bad. The quadriplegics stay a bit longer. They stay like almost 8 to 9 months because they have to obviously learn a lot more skills because they
Yeah.
have lost function of their upper limbs or arms.
Mm.
Whereas for me, the main skills that I had to learn was how to transfer from the bed to wheelchair. I mean, basically, it's about adjusting to life in a wheelchair.
Yes.
That's the main skills I learned how to go overcome curbs in the wheelchair, and then like how to talk, do your bowel and bladder stuff management.
Oh my
It's
God.
because obviously that's been affected greatly by the spinal cord injury.
Yeah.
But I think, which is really interesting, 2 months, because 2 months later, after the injury, it was interesting. I had a birthday party, and my because I turned 29 in the Royal Talbot Hospital. And I had good friends who came and celebrated along with my husband John. But that night, a beautiful gift from God heaven. I was able to move my left leg suddenly, and I went, "Oh, this is a
Wow.
miracle!" And of course, I was ecstatic. I was like, "Oh, I'm definitely incomplete because I can move my left leg now." I mean, it's not much, like it's not a great movement, but it's something. So my left leg within a couple of weeks regained full movement. I mean, it wasn't great. I still had a little foot drop, but my right leg was quite heavily paralyzed. I
So
think it's
this
because
is like 4 months after, is it 4 months after your
no,
injury
two
or
months. I was still in
2 months?
rehab when it happened. So I'll
Okay.
I'll take anything, even if my toe moved, I
Mm,
will take
yeah.
it. But my whole left leg moved, I'll take that even more. I was like,
Yeah.
I was obsessed. I was like ecstatic. Then my right leg obviously remained paralyzed because the impact was on my right. So I knew that it will take a lot longer for the ride. But I think sadly the hospital system or at least the rehab system was designed a way just to like teach us just to live in the wheelchair type of thing, and they were
Oh.
not very open to new ideas about intensive rehab
Mm-hmm.
or like retraining the legs to move again and things like that. They're not too open about that.
Yeah.
So what I did was in 2008, obviously we only have access to YouTube videos and a bit of
Yes.
Facebook.
Mm-hmm.
So thankfully, thanks to YouTube, I started YouTubing how to walk again after a spinal cord injury. And guess what?
Wow.
Yeah, videos of people walking again in America popped up, and a facility called Project Walk was the main. Like they all attended Project Walk, and they started
Mm.
walking again.
Mm-hmm.
And I went, I have to go to this place. But for myself, before I did that, I had to return back to work. I mean, I had jobs lined up. The fault like in 2009 I had jobs lined up, but I couldn't work for the first half of the year because I was still in rehab.
Yeah.
But the second half of the year, I was still able to do that role, but very part time. So thankfully, I had a really good boss. Interesting, I went back to the Alfred to work, which is my whole life is full of ironical things. But I went back to the Alfred to work as a rehab registrar, but in Caulfield Hospital because that's the rehab
And you were,
facility.
so you were in the wheelchair going around
Yeah,
by
I was
yourself.
correct. I was working um in that role, and interestingly, the role was a spinal term, and I'm like,
Oh, wow.
this can't get any more ironical
Uh-huh.
than this. I was returning back to full like part-time work in a spinal rehabilitation role in
Mm-hmm.
Caulfield Hospital. But to me, like, I was able to really connect with my patients because I really understood what they had to go through, like every
Mm-hmm.
single thing, what they had to go through.
Yes.
Yeah. So I
Yes.
think that was a beautiful teaching lesson in my life.
Yeah.
And I think the way I see and practice medicine have changed a lot. I
Mm.
mean, obviously it has changed a lot more since then, but at that time I was a different person. But I never gave up that I really wanted to go to this project walk place. It's in Carlsbad in California. And I inquired. So I remember December 2009, I was watching Channel 7. They had this show called, what was it called? Studio 7 or
Mm-hmm.
Spotlights. They always have news about people who are resilient and overcoming obstacles and that kind of
Mm.
thing.
Yeah.
And they featured one of the person that I went to rehab with in the Royal Talbot, Michael. And he went to Project Walk, and I went, this
Mm.
is a sign. Like this is an Australian going to Project Walk,
Mm-hmm.
and that's what I did. So the moment my term at Caulfield Hospital finished in February, I, the a month later I went to Project Walk in Carlsbad, and then I spent a couple of years over there learning how to walk again.
This is in America, in
Yeah, that's
whereabouts in
correct.
America?
Carlsbad. It's
Carlsbad.
kind of in the middle of LA and San Diego. It's
Okay.
where Legoland is. That's the only Legoland in America. It's in
Oh, okay.
Carlsbad. There's
Okay.
flower fields and things like that. It's beautiful. It's a
Yeah.
beach. It's very beautiful. And
Wow.
I'm
So
glad
your husband
yeah.
took you there?
Yeah, we went there. We're gonna just pack our bags and we don't know what to expect. Let's
Okay.
just run with it. This was a higher calling. And
Yeah.
then, and that's it. And then we spent a couple of years there. I had to take time off training, of course. I didn't say I was going to Carlsbad, but that would have landed very well with the college. But I just told them that yeah, I need to take time off to focus on my health or something. They were fine with that. Like they allowed
Of
me to
course.
take
Yeah.
a year, yeah, almost a yeah, a good year off. And even though I spent a couple of years in total in America, I came back to Australia quite often. And every time I come back to Australia, I'll do like job share with some other rehab registrar.
Oh,
Because there's a
okay.
lot of people on maternity leave, they want a job share. I just find those people and we just work together. And I eventually just added my accrue all my rehab training time like that. So
Mm,
2012 was a bit like, even though I spent some time in America, I also went back to Australia to do a bit of that kind of part-time work.
hmm.
But 2013 was when I came back for good from America because I decided I can't go to America forever because I still have to resume my medical career.
Yeah.
I still have to be a rehab physician. I miss Australia because I was flying to America a lot and, culturally it's
Yeah.
quite different. Even
So
though
what
I
was
know,
it? What
yeah,
was it like when you were learning to walk in America?
yeah, I can definitely go into that. Learning to walk again was if the word mindfulness, you know how it's such a buzzword. This is truly
Yes.
what I experienced because I had to just focus on one thing at a time, whether it's taking steps like walking or getting exercise like strengthening exercises, balance exercises, all the various exercises that I had to do to not only um, relearn to walk again because I had to be like a baby where I had to crawl and then I
Hmm.
had to squat on my knees. That's what I meant. 2 point kneeling, and then stand up on my own, and then start taking steps. It's just like a baby. I had to go through the same process myself,
Wow. How
and that's
many
mindfulness.
hours a day do you do these
Yeah,
exercises?
I have to say that those years in project work, I was the fittest. I worked out like 5 hours every day. I don't know how I did that.
Wow.
If I were to do it now, I won't be able to even do an hour. Yeah, I did 5 hours every day, Monday to Friday.
Hmm.
And then the weekends I just chill. We'll drive to LA to relax or San Diego.
Okay.
We had a
Yeah.
choice. 1 hour north or 1 hour south. Take your pick.
Okay.
It's a
Yeah.
bit like that. Yeah, it was fun, very fun. Even though it was very tiring, grueling,
Yeah.
it was fun to explore a bit of America. And yeah, when we connected with a lot of people with spinal cord injuries as well. I think
Oh, okay.
that was the thing that healed me was the fact that I had a community of people like myself
Mm,
and
mm.
carers or spouses who had to look after people like me. So we all just formed one big community and we just looked after each other for a couple of years. And then it was time to go back to Australia. Very sad, but life goes on for all of us.
Yes.
And yeah, I think when I came back in 2013, there was that whole like, oh, you got to get back to training. You know how the
Yeah.
medical training system is a bit like that. You got to get on the bandwagon again. You got to get back to the hamster wheel. That's what I did. So 2013, I still worked. I believe I still worked part time because I wanted to still do a bit of rehabilitation with my team. I have a team of people at that time now. I had my own physio. I had exercise physiologist. I had someone to help me with clinical Pilates,
Hmm.
because that was the main part of my um, rehabilitation program in America was clinical Pilates.
Mm.
Because when you're lying flat, you could adjust the springs to very minimal tension,
Yeah.
and then you can work on all the muscles that are weak. So I did all that, and then 2014 was when I started full time work again. And then I sat for my exams in the same year. I don't know why I did that, but I just said I just want to be a rehab physician. I've taken too much
Mm.
time off, and I think yeah. Then I passed the exams eventually in 2014. I became a qualified rehab physician, but I think the whole process just burnt me out. Like
Yeah.
first of all, the spinal cord injury itself burnt me out. So we can't always say that burnout is a workload issue type of situation. That's why you burn
Hmm.
out. I think
Hmm.
life can burn you out. Chronic illnesses can burn you out.
Mm.
And neurological conditions can burn you out. And that's what ended up happening. Um, Before I know it, I think I believe in 2015, I was starting to have some symptoms of it. And I found out I was pregnant with my son. So, it's
Wow.
like, oh, great, I can't really recover from my burnout because I now have
Mhm.
to figure out how to do the mat leave stuff. So and then after that, I took mat leave to look after my son, and then went back to training again in 2016, a year later, to start my pain fellowship. So it was like bang,
Wow.
bang, bang, bang. By the time I think I finished my pain fellowship in end of 2017, I was very burnt out. My study group members were all burnt out too. I
Wow.
think I think because that whole year we were just, you know, studying full on 100% every week study group. Yeah, it
Wow.
was it was a full on year. And then 2018 was when I started, first year pain specialist, took on too much too soon because I was excited. I was
Yes.
like, yeah, I got my letters.
Yeah.
Just gonna work 6 days and it's fine. And then before you know it, 2019 was when my burnout was so severe I just couldn't even go to work at all. That was July 2019. I had to take about 3 months off work. That
So you had an injury, you had to
Yeah,
train to become a medical specialist, then you had a baby, then you were traveling. No wonder
yeah,
you were burnt out. I would be. And then
yeah, yeah,
yeah, you're still trying to learn how to walk properly.
yeah, exactly. Yeah, and I think, I'm still learning how to walk properly even up till now. I mean, I just went for hydrotherapy this morning. Like I've been doing
Yes.
hydrotherapy since 2009. How long is that? 16 years. The journey
Yes.
never ends because I need to maintain my function as someone with a neurological condition. It's just the way it
Yes.
is. You just have to like live with it and move forward. Um,
Yeah, yeah, yeah. For the
but
listeners, yeah, Olivia uses double walking sticks, but she's
mm,
able to walk slowly. But it's a pretty
mm,
amazing that you had all this injury and you can get back on both feet and walk
mm,
independently. It's pretty amazing.
exactly. So this kind of life-changing experience, really what doesn't kill you make you stronger type of thing.
Yeah.
And every time I face a lot of you know, obstacles and challenges in my professional life or family life or personal life, I always look back to this injury. If I can overcome something like that, then this is a piece of cake, like literally.
Mm,
Anything else, even exams was like, that's how I reframe everything. If I could overcome all of that, exam should be easy, right? Like not easy, easier compared to losing your legs or something like that. But I just wanted to share that the burnout journey was interesting because even though I took that couple of months off work, I didn't fully recover. Like physically, I felt okay, but still a bit like brain fog, still irritable. I mean, taking time off didn't really help. 100% help a little bit, but not a
mm,
lot. So I went through an interesting journey. I wanted to find a way how to like deal with burnout as a doctor. So I
mm,
just remember getting my first coach sometime I think at that time in July 2020. I was pregnant with my daughter when I got my first coach, a
mm,
mindset coach. And then I realized that the coaching process really helped me and made me
mm,
really excited. And I went, okay, coaching is so wonderful. My life has transformed 100%. I want to do this for myself in the future, just to coach myself. But
mm,
that's what I did. I went through a coaching certification called, is it called Beautiful Life? I think it's called Beautiful Life.
mm,
I don't really remember, but it's called
mm.
Beautiful Life Coaching
Yep,
Academy.
yep.
And I finished the certification, and I realized that I could do this to help other people through burnout
Mm,
too, because coaching helped me. And that's what I started doing. I started because at that time when I started this coaching journey to coach myself and then coach other people was interestingly at the lockdown periods of in Melbourne.
mm,
So I started coaching a few colleagues pro bono just to help them out because they were all burnt out from being deployed to the front line and all this. And yeah, and then I started getting my first paying client a few months later after that. Before you know it, I had a coaching business, but I didn't know how to do business, which is yeah, a whole different personal development journey in itself, setting up a coaching business.
yep.
And I got a business coach and all that stuff, but I realized I struggle a lot with technology and the
Mm,
back end of the
mm,
business. And before I know it, in April 2021, this is probably even more of a severe burnout episode than the one in 2019. I
Oh,
landed in
wow.
hospital. I was in hospital for 6 weeks.
Oh,
I
okay.
neglected to look after myself.
Okay.
I developed cellulitis of the right leg, and I ended up on IV antibiotics for 6 weeks.
Okay.
Went to Cabrini Hospital. At least that was a nice hospital. Yeah, and the nursing and medical staff were excellent. So I received topmost care. Topmost care. Yeah, I recovered eventually, but I had coaching, but I still burnt out. There must be another way around to prevent this kind of situation from happening again. Because I
Hmm.
was away from my kids for so long, like
Yeah.
6 weeks. Um, what happened was that I started doing more research on burnout.
Hmm.
And I started to look into the work of Dr.
Mm,
Gabor Dr. Stephen Porges, who invented the polyvagal theory,
mm,
explaining the nervous system reason why people burn out. And I realized that it's all interconnected. Because I see a lot of my patients with chronic pain also facing burnout and quite dysregulated in their nervous system. They're very traumatized. Um, and I started piecing everything together. Burnout is a symptom of dysregulated nervous system. So is um, so is chronic pain. So is all this IBS, whatever you want to name it, fibromyalgia. Everything's all interconnected. And I went,
yes.
so burnout is actually one symptom of a dysregulated nervous system. So I need
Mm,
to hone in on this. So I did a lot of training under Stephen Porges just to understand this framework better. So now I've evolved my coaching to include more nervous system coaching now, include and then mindset, because you can't think your way out of burnout, which is what the mistake I did in the
mm,
past. I tried to think out of my way out of burnout. It didn't work. And when I introduced nervous system coaching, helped me help my clients. But to answer your question about the speaking journey, I started doing a lot of webinars for my coaching business. I think that was how I started my speaking journey. Because I was told by my business coach, of course, to do a masterclass once a month to
mm,
get people onto the masterclass so they
yes.
can become if we are the right fit, if the audience is the right fit, then they will become my coaching clients or something along that lines. And
Mm,
I started realizing that I really enjoy speaking to more people than just one-on-one. So I started with webinars, started with summits. I started getting invited to summits like mental well-being summits online because we're still virtual at that time. We're talking about 2021, 2022. And the more summits I attended, the more people knew what I spoke about and the more invites I got. So it was a amplifying effect. And I enjoy speaking a lot more. Still coaching. I still love coaching, but probably not as much as speaking. And I realized that speaking will be the only way I can do to amplify my message to more people about burnout. Because if I speak
mm,
one on one, it'll take me like 100 over years to amplify my message.
yes,
Whereas if
yes.
it's too many more people, it'll be a lot quicker than 100 years. Let's put it that way. And that's how it all started. I built a lot of relationships online and offline too,
Mm,
and that's how I ended up being a professional keynote speaker now, speaking a lot more on stages, doing more workshops. Still have quite a number of one-on-one clients, coaching them,
mhm,
but yeah, my work is predominantly more speaking rather than coaching. So if you think about in the past, I used to be a coach who speaks, and now I'm a speaker who coaches.
mm,
So my
yes,
identity has shifted over time,
yes.
as we all do. We all grow in our business and we all evolve.
So how do you coach people to recover from burnt out? And what do you think has helped you the most to get over your own burnt out?
Yeah. I think realizing that the nervous system has something to do with it was a
Mm,
game changer for me because, as I said, I used to try to think my way out of burnout, try to mindset my coach myself out of it. It didn't work. I didn't realize that I had a dysregulated nervous system. In fact, my predominant nervous system state is probably hypoarousal or more freeze state, where I'm just a bit like numb, disconnected, and um things like doom scrolling would have been my way of coping as well,
Yes.
because
Probably mine
in a
too.
in the freeze response, that's what you do. And I'll find myself at work to be opposite. I'll be more hyper arousal, where I'm more sympathetic because I had patients to see back to back, and then I'm always anxious. I'm always on edge, and I'm always drinking so much coffee, and that didn't help. It just makes me even more hyper arousal and
Yes.
more anxious and more on edge. So I realized that swinging from hyperarousal sympathetic to hyperarousal, like that kind of dorsal free state, just swinging like a yo-yo, that's how I burnt out. I was so overwhelmed and I burnt out. It's only when I realized what was going on at the nervous system level, I went, oh my goodness, that was the reason why it took me that long to figure out to recover from burnout, because you just can't think your way out of it. You got to do all these somatic tools or body tools to be more aware of the body, basically, that in order to prevent burnout, or even if burnout starts to come a bit early, you can nip it in the bud pretty quickly.
Mm.
So I think it's just being more connected with my body. I'm already quite connected because of the spinal cord injury.
Mm.
Mindfulness wasn't that difficult for me, even though I had a monkey mind sometimes. I still get distracted in a bit when I'm trying to meditate, but I think just realizing that I need to do a lot of body or somatic tools to within my nervous system was the game changer, I feel, and
Mm.
help a lot of, and I use all these tools for my clients, help them so much as well.
What do you
Yeah,
mean by somatic tools? Can you
somatic tool, yeah,
elaborate?
yeah. It's just being aware of that the body is also dysregulated, and not it's nervous system dysregulation is a whole body thing. It's not just the head that you're stressed. It's not just coming from cortically. And I think that also is what is happening therapy wise. A lot of psychology is top down, where it's CBT, cognitive behavioral
Yes.
therapy, acceptance commitment therapy. It's top down. That will work. That works for 20% of the time.
Yeah.
80% of the time is actually from bottom up. You got to work on the nervous system up, feeding to the brain. So techniques like things like grounding helps. Like
Hmm.
what you do as well, the breath work helps too.
Yes.
That's all somatic tools. And also just moving your body a lot. Like I just remember like when I have a lot of sympathetic energy, my nervous system coach taught me to do this activity called ecstatic dance, because you have to dispel your sympathetic energy.
Mm.
So what I did was, I'm a huge Swiftie, switch on Taylor Swift music, and I'll just dance for three
Okay.
minutes, and then that releases the sympathetic energy. And she also taught me that in order when I'm in a sympathetic state, because obviously I can't do push-ups on the ground, she
Mm.
told me to do chair lifting my chair like this from my wheelchair. It's called tricep dips. What do you call it? Yeah,
Yeah.
it's like using my arms to lift myself up from the wheelchair, or if I could stand up, which I can, to do wall push-ups. It's just you need to dispel your sympathetic energy somehow.
Mm.
And if you are in a hypoarousal or dorsal state, you have to bring your body back to awareness. One of the things she taught me was this thing called it
Tapping.
sounds really awful because you're like beating yourself up literally on your
Yeah.
arm. It's called what is this exercise called? I just call it like bilateral arm tapping or
Tapping.
something.
Okay.
I mean, you don't have to whack yourself. If you want
Yeah.
to, you can, but it's very painful. So
Yeah.
it's just when we are stressed, we always forget that we have a body. So it's a
Yes.
bit like that. So we do this is to create awareness. Oh, I've got an arm. I've got this, I've got that. And then you can tap your shoulder, you can tap your thighs and whatever. It's just to bring yourself back to like
Mm.
the present moment. It takes about 3 minutes, so you have to be consistent and not just tap for 10 seconds. That
Okay.
that,
Yeah.
that really helps. Yeah.
Yeah. So I previously had a guest that talks about tapping as a therapy. She does
Yeah, yeah.
EFT
Correct. Yeah.
tapping. Yeah.
EFT
Same
is
thing.
different. It's a nervous system tool.
Okay.
I think they you rely on acupressures. That's why they do this.
Yes.
They do
That's
this. They
right.
do
They do
this.
it in the
This.
pressure points.
Yeah. I mean,
Yes.
I'm not an expert in acupressure, but I've had acupuncture for the last 16 years. So eventually I know where the points are after
Yeah,
because
yeah.
it's like, you know, my
Same.
acupuncturist does the same points over and over, and then he educates me over the years what to do. But EFT, yes, it's a nervous system tool. It is like
Yeah.
a somatic tool if you think about it, because you're
Okay.
bringing yourself to your body awareness, like whether it's
Yes.
face or whichever areas. I think they do wrist as well. Anyway.
So do you think if people aren't quite burnt out yet, do you think they should do these somatic tools to prevent themselves from getting into burnt out?
Yeah. I think doing this 3 minute, just for 3 minutes, doing a daily nervous system exercises, a series of them will help so much.
Mm.
Um,
What's
with
your exercise look like? What's this
yeah,
movement look like?
I use an app called NeuroFit. So
Mm.
I'm a NeuroFit trainer because I've been trained in using the app. So
Mm-hmm.
this app is really good. It allows you to check in, and then you can check in whatever states you're in. So
Mm-hmm.
they will ask you, are you in a hyperarousal, hypoarousal? Are you overwhelmed, which is like a mix of hyper and hypoarousal kind of thing? Or are you in a um, play state where it's a bit of sympathetic, kind of sympathetic and creative energy kind of thing?
Mm-hmm.
So
Okay.
that's play. Yeah, you know, when we are in play, we're like, oh, very creative and very edgy. You know what I mean? And then ventral vagals when we are calm and serene and very compassionate, open in arms. And then we have stillness. Interesting. Stillness is kind of a mixture of dorsal vagal and ventral vagal. Ventral vagal is that calm energy, and
Mm-hmm.
also the freeze, the good freezing energy, not the bad freezing energy. That's why
Mm.
when you're stillness, you just feel this zen-like feeling. That's stillness. Um, it's funny because I was just talking to quite a few friends yesterday about how we struggle to be still. Stillness
Yes.
is really difficult. It's because we are constantly distracted by digital,
Notifications.
yeah,
Yeah.
notification, digital things. So I think stillness is definitely quite hard to achieve, but we can get there eventually. But yeah, so the app will assess where you're at, which
Mm-hmm.
states, and then will design the exercises that you need to do for that
Mm-hmm.
state. It's very good.
Mm.
It even looks at my heart rate variability for that time. So my goal obviously is to get my heart rate variability to a stable level, and also for my clients. And
Mm-hmm.
then the funny thing is, my clients will the after you've introduced an app, I have to make sure that my clients consistently use the app. That's the thing that's
Yeah.
hardest, is the ability to consistently have the habit of using the app. Because I was
Yes.
guilty of it. I struggled to use the app initially, as even as a trainer. That is terrible, isn't it? But I struggled. I can imagine my clients will have struggled even more.
Yes.
So I needed to get them to be consistently using it. So I had to do a bit of mindset tools, like mindset coaching, to help them
Okay.
develop the habit structure to continue using the app.
Yeah.
So I found that using this app to do nervous system work and a combination of nervous system coaching and mindset coaching was is the best combination so far.
Yeah.
And I thoroughly enjoy this because I do it for myself in work, and my clients all work for them too, and they're all thriving in a good way. They're not yelling at their kids anymore, and they kind of thing,
Mm.
or their husbands, or they're not cranky at work.
Yeah.
They're very yeah, they're feeling very calm and zen like, which is great, you know.
So more mindfulness and tapping and uh, dancing.
Yeah, a bit like that, a bit of everything. Mindfulness is more like a top down. I feel it's a top down
Mm-hmm.
because yeah, I think it's certain parts of the brain, right, that you do the mindfulness. It's not a body kind of, or not a somatic tool, but I think doing a combination of both will help with preventing burnout and reducing chronic stress, definitely.
Great.
Mm.
So you feel like after so many years, you're much more on top of it for yourself?
Yeah, because I'm able to spot my own warning signs pretty early, so I usually just increase the nervous system exercises to twice a day versus just once a
Okay.
day.
Yeah.
If it's maintenance once a day, it's fine, because it's hard to find time to do twice a day sometimes.
Yeah. Yes.
Yeah, once a day is already like pretty good if you can do it every day consistently. Twice a day, if you are feeling that you need a bit more support, twice a day is good.
Okay.
So I'll try to do that for a week or two, and then after that, I get back on the bandwagon, like the baseline again, which is
Okay.
yeah.
I haven't heard of the NeuroFit app, but I'll download it for myself
Yeah,
and I'll have a
yeah,
look at it.
yeah,
I've got
yeah.
so many apps. Sometimes some apps I'm consistent using every day. Some apps I'm not really.
Exactly, yeah. That's the thing. It's like which tool is gonna be, yeah. I remember like my coach telling me about how he has downloaded so many apps himself and he only uses like 10% of it.
Yes.
So we have to learn how to declutter, I guess, our minds. I think he was
Yes.
using it as an analogy, and then he actually showed us how many apps he had, and we went, "Whoa, there's a lot
That's
of apps."
it.
Yeah,
Yeah,
yeah, exactly.
yeah. Amazing. Great. So just tell us what's the top tip that you want to share with my listener about how to prevent and treat burnt out? What would you just say or the top thing that you would suggest them to do?
Mm. I think the top tip, which I suggested to quite a lot of people, whether I'm speaking on stage, doing media work, media commentating, or even telling a group of trainee doctors that I have to kind of coach and mentor at work. The thing is, we need to do a safety check-in or awareness
Mm,
check-in every day. Think about the
mm,
pilots every
mm.
day. And before you depart, not depart, before you fly off, they do, I don't, they take about 10, 15 minutes to do a check. I'm
Yep.
pretty sure they take a while. I mean, they have 300, 400 passengers
Yeah.
on planes, so they have to do it for
Yes.
safety reasons. We have to do the same. We have to spend a couple of minutes or even longer to just check in where we're at. What
Mm,
is our nervous system state at that point in time? What's my body feeling? What are my needs right now? Things like
mm,
that. Am I
mm.
being, and then reflecting on whether you're being kind to yourself, all these things. Um, yeah, just take at least 10 minutes to do a safety check-in for yourself. We're talking about neurological safety check-in. Let's just do that.
Yep.
And I think that will create some kind of awareness muscle every day to be built up. And then and before you know it, then you start to be aware about what areas you need to focus on. So I think a safety check-in is very
Yep.
important. As in a neurological safety check-in every day. Very, very crucial.
So just talk to yourself. How am I feeling? Am I stressed? How's my nervous system? Am I
Correct.
tense?
Yeah, exactly. Am I on edge, anxious, which is sympathetic, or am I the opposite, numb, dissociated, wanting to just lie on the couch, on in the bed and not do anything? That's hyperarousal. Where are you
Mm,
at? Or are you play? Are you feeling creative energy and sympathetic, a little bit of sympathetic? Or are you in stillness, that zen, calm moment? Things like that.
amazing.
Yeah, yeah.
Great. Amazing. Where can people find you, Olivia?
Yeah, people can find me on various social media platforms. I'm quite active on LinkedIn, also active on Instagram and Facebook. And I've got a website, www.drolivialeong.com. That's my website. So, yeah. And I'm sure
I'll put,
Avi will provide links. Yeah.
yes, I'll put all the links in the show notes.
Yes, exactly.
Well, I encourage everybody to check you out your information and connect with you and learn from you how they can treat and prevent burnt out. You're the burnt out expert.
All right. Thank you, Avi. Thanks for inviting me today.
Thank you so much for coming on, Olivia. I
Yeah.
love connecting with you. I'm learning so much from you all the time.
All right. Thank you. Yeah. We're learning
Great.
always. Yeah. Thank you.
Thank you, all the listeners, for coming on to the Prescribing Lifestyle podcast. And as always, if you don't look after yourself, you can't look after anybody else. Stay tuned. Until next time, we'll have another guest.